Okay, hello guys. So today we're gonna be playing this thing is like called Charismatic Hospital or something, or Hospital. It is a very interesting game. It's similar to the RN simulator games. Forgot what the first one was ever called, but essentially it's when you work at a clinic and you work your way up of the nurse ranks. Um, in the future, they do have a private practice license pre-ordered. Once that comes out, I'll be doing a video on that too. Um, but we're going to be doing a 20-minute play long or 15-minute play long, and then you can see how it's like. Let's get right to it. Alright, so we're going to pick a severe patient first. Actually, no. Let's start from low. So low should be very easy. Less severe injuries. As you can see, I got 65 admittance. So you view the file, you see all their stats. So it's like joint pain, inflammation, arm trauma, tachycardia, which is heart rate over 100. You got needs, which is like to keep them comfortable, and then lastly is diagnosing. So first off, we need to rate this. If you ever play this game and you don't know where anything is, just click on this and it'll show you where it is. Anyway, so we need a inflammatory RX, two inflammatory RXs and a beta blocker. 1, 2, and beta blocker is that. There it is. And we also need an order X-ray, so that's gonna be fun. Okay. That's 1, 2, 3. I need to get my gown. Oh no, wrong thing. They also have IV drips, as you can see. So coffee and sandwich. Coffee is over here, and sandwich is in the storage locker, the storage room here. Sandwich, there we go. Coffee. Arm trauma. So I need to order X-ray, which is over here. X-ray view. Insurance must approval tests. Okay, request approval. Approved. Okay, order scan. Does this actually take money off me? No, it doesn't. Okay. And then he's off to the X-ray. He's come back. So I never actually did this before. This is my first X-ray. Apparent spiral fracture in ulnar bone. Is that his leg? Apply a cast to injured arm and administer pain medication as needed. Okay. Let's have a look at this file again. Plaster gauze. And I think that's all that we need. Which is all the way over here. There it is. There we go. Oh no, what do I need to do? So I need to drag that up. What? OF. Oh, I see now. Okay. So he's got a joint pain, inflammation, arm trauma, and tachycardia. Tachycardia isn't involved in this one, so it's joint pain, arm trauma, and inflammation. Joint pain, arm trauma, and inflammation. Joint pain, inflammation, joint pain, arm. Okay, there we go. Since it's an arm fracture, it's not really needed to keep him in the hospital, so that's just sent home. And then obviously it gives you a story on a summary. The patient was sent home with a sling and pain medication with proper rest and outpatient follow-up. The fracture healed without complications. Alright. Let's get this ready. Honestly, I'll be keeping it up with all the updates. So next, let's try a moderate patient. Let's do you. They do tend to fall over a little bit. As you can see, there's a XP progression here. My total XP is 2,711. Bedfall. So I need gallon, juice, sandwich, coffee, Tylenol, oxygen. Okay, I need to get oxygen now. Oxygen is right here. Getting gallon. And the coffee. Alright. Tylenol, beta blocker, and Drylex. Tylenol, Drylex, beta blocker, Tylenol. Okay. So I need saline and juice and sandwich. Saline, if you don't already know, is obviously a salt water-based type thing. It's mostly used for hydration of the blood, which is, and it can also treat dehydration. It's more of a comfort thing. Saline that's over here. All right. Restock that, and then prick saline. Okay. So fever, chest pain, shortness of breath, and dehydration, cough. Fever, chest pain, shortness of breath, dehydration, cough. Chest pain, cough. There's no other constriction, hemorrhage. There's no hemorrhage. Fever, cough, shortness of breath, chest pain, dehydration. Fever, chest pain, shortness of breath, dehydration, cough. Yeah, that sounds right. And now I can discharge him. Just send him. Sent home with oral antibiotics and breathing treatments, recovered steadily with proper tests and medication compliance and avoided complications. Yeah, I love this game, it's so fun. Alright, next up let's do a severe patient. Right, this one looks a bit bad. Let's take you. Okay. So he's got a oxygen on. Beta blocker Zofenix. Zofenix. Is it Zofenix or is it? I think it might be. And he's gone. Okay, needs juice and ice pack. Ice packs are over here at the desk. Juice is over here. Okay. Chest pain, shortness of breath, and vomiting. Heart attack. Right, I'm going to send them to hospital because obviously that needs to be treated properly. Rush cardiac unit. The patient received clotbusting medication and stent placement after discharge and cardiac rehabilitation. They made a strong recovery. Okay, that's all good. I'm going to try and see if I can get a code blue. Let's see if I can trigger one. So I'm not going to do much here. Alright, I'm just going to wait until he goes into a code blue so I can show you how it's done. Let's just give him a down. What an ice pack. Ice packs over here. Water. Right, so he needs Tylenol. I'm gonna get stocked up. Let's see if we can trigger a code blue. Let's just wait for a little bit and see if it happens. I'm not really sure if it's triggered by just them being sat for a while or if it's triggered by their specific condition. Dehydration, fever, hemorrhage, infection. Dehydration, fever, hemorrhage, infection. Dehydration, fever, hemorrhage, infection. So he's a septic shock. Let's give it 2 minutes and see if it works. If not, I'm going to have to keep on playing until I get code blue, which I'll be skipping to in editing phase. I'll do some malpractice and see if we can trigger a code blue. Oh, obviously, I think it says that is a pharmacist. Is it no? Is there no pharmacy next to it? I think it's just clinic actually. I think it's another game I'm thinking about. All right. Okay. Let's put some saline into here, shall we? Okay. So she did not even need that. I got EpiPen on me. Oh my god, I get some more soon. What's gonna happen? Oh no, I think I need to give I need to give her some like antibiotics and blood. Let's see which can trigger it. I got 2 salines because that's what the she's still alive, so it was just saline. So let's see if we can put some antibiotics in her. See if it does anything. If this triggers nothing, I'll be surprised. Is that even going into her? Huh? I think there's no way. Wait, is there a way to do it? It's 2 blood. We stop. Oh, it doesn't allow me to like put it in. Oh, let's restock this. I didn't even realize I could like put multiple in at the same time. Okay, that's a bit of a. I think let's have a. Is off the next. Oh, sure it is. Is off the next. Environment X. Yeah. Six nine. Where's 6-7? Well, if I give it epinephrine and she doesn't need it. Oh, I can't do that. That's a shame. I'm trying to trigger the event. Alright, water. Bottle of water. Juice. Blanket. Blanket for you. Eye itching. Excessive veterinary. That's just it needs. That's juice. And let's do 3, 2, 2. Okay, that's all tret. Right. Vomiting, eye action, excessive tearing, phalange inflammation, vomiting, eye action, excessive tearing, phalange inflammation, eye action, excessive tearing, vomiting, eye action, excessive tearing, phalange inflammation, excessive tearing, vomiting. Okay, it's chemical burn. Alright, it's for specialized chemical burn treatment on wound care. Patients when neutrals and dressed properly have to discharge a healed with minimal hardening. Right, what I'm going to do is I'm going to skip to a code blue so I can showcase that. So yeah, let's get to it. Yeah, I'm gonna get this person here. What's next? EpiPen and blood. Alright, yeah, code blue. Okay, there we go. Alright. Compressions. I think I need in this one place. Push EpiPen. Oh shoot. Why is it IP? Saline. Okay. So what's off next? EpiPen, blood. Yeah, so it's as simple as that. It's pretty good, but it's just it's a bit it doesn't have like randomized like outcomes though. It's a bit bad, but it's fine. I'll need it off next too. Do I need some? I need more some. I need blood. Oh, where's my EpiPen? Is it in here? Oh yeah, it is. Did I do something wrong here? I'm pretty sure I did. Right, vomiting, MA, swelling, and hemorrhage. Okay, let's discharge that person at mid hospital. Okay. Anyway. Right, there is currently there's nothing else except for that, so temporarily out of order, so probably a surgery room. Staff rooms, boardroom, what's in here? Meeting room, break room. Some more decor here. Probably far being FK. There's nothing past here though, which is a bit strange. I think it's like a new like the next update. You can do cleaning up, but it doesn't give you any rewards. It doesn't give you any cash XP. Simple as that. Right now, I think it's all basic, but there's more to come. As I said, there's a private clinic license coming up, which is gonna be probably fun. Let's see if we can spot what's happening in the next bit. Yeah, so this is probably this is probably the private clinic area back there. Anyway. But yeah, this is definitely a game that you should check out. I'll link it in the description of this video, and hopefully you guys enjoy as much as I do, because it's a bit of a grindy game, but it's also fun. Anyway, see ya.